Now, PCOS, polycystic ovarian syndrome, is a huge factor for many, many women. So for those of you who are dealing with PCOS, this is going to be an important slide to understand. The first thing that happens in PCOS is that you get less follicle stimulating hormone production. And this is mainly due to chronic stress concerns. We do not know exactly why this is happening, but we believe for it to be caused primarily by stress. And you're also getting more luteinizing hormone. This is especially true of thin type polycystic ovarian syndrome patients. There are more thin types and there are overweight type PCOS individuals. At the same time, you get other hormone changes. Now, it's important to understand, look at where all this stuff is coming from. It's coming from primarily the hypothalamus and pituitary, which then have these downstream effects of less FSH and more LH, right? And notice how I say there with the more LH that this is stress. That is believed to be the cause of this. Now, with some of the hormone changes, that's a little bit different, which we'll get to in a minute. But these two effects of less FSH and more LH means that the follicles do not mature, and that rather than the follicle erupting and releasing the egg, it does not happen, and you get ovarian cyst formation because there is no ovulation. That is an important piece of polycystic ovarian syndrome. Now, some of the hormone changes is increased insulin. Now, here's an important concept to understand. Too much stress hormone, especially too much cortisol, can cause insulin resistance. And that is typically what might be going on with the thin type PCOS individuals. Too much food, especially food in the form of high starch, fat, those kinds of foods, high calorie, can cause high insulin levels. And this is typically the issue in heavy type PCOS. I'm just taking a minute to sort of distinguish between thin types and that they may be more impacted by stress, and heavy types that they may be more impacted by food. But do understand all of this is going on in both types. With more LH and more insulin, you get more testosterone release in women from the ovaries. And this is why many polycystic ovarian syndrome patients will get hair growth and things like that related to, and fat storage around the middle. In other words, they go from a female fat distribution of breast, hip, thigh, butt fat to more of a male distribution of belly fat. And so these women go into more of an apple shape. And this is primarily a result of luteinizing hormone and insulin both turning on testosterone production in the female ovaries. At the same time, you have these effects of lack of ovulation, which means no progesterone, and hormone changes that have to do with stress that lead to lower estrogen and progesterone. And together you have a lower progesterone to estrogen ratio, meaning there's estrogen dominance. And so all of that may seem a little confusing, but the end result of this is that this is a very complex hormonal system going on here. PCOS is not just about eating. It can also be about stress, and this is a hormonal thing that's going on here and needs to be addressed hormonally. And so hopefully this helps you understand what is going on. Primarily that you have excess luteinizing hormone and or insulin production, which creates more testosterone production. You have less FSH, which means there is no ovulation, and you have this lower progesterone to estrogen ratio of estrogen dominance. And many of the effects that symptoms that people with PCOS have are related to this cascade of events.